So, differential diagnosis of the lung abscess. Other non-infectious processes which can lead to the formation of cavity in the lungs. We said that there is necrosis of the lung tissue and the cavity formation along with the lung abscess. If that is associated with some other non-infectious processes or condition, that comes under the differential diagnosis of the lung abscess. Lung infarction is one factor leading to the cavitation and abscess. Lung infarction. Infarction is the death of the tissue, or if that is present in the lung and it becomes black or infarcted, that tissue, that's the lung infarction. Any malignancy or carcinoma can also be in the differential diagnosis. These can lead to the formation of cavity. Sequestration, vasculitides, lung cyst or bullae containing fluid, not abscess, septic emboli from tricuspid valve endocarditis. So all these are the differential diagnosis of the lung abscess, but remember they are all the non-infectious condition. No microorganism is involved in this, and this can be the lung infarction, malignancy, sequestration, lung cyst or bullae containing fluid, and septic emboli, tricuspid valve endocarditis.